Shame around failure and rejection isolates physicians and fuels burnout. Today's conversation about failure will share what failure actually teaches us, why the physicians who struggle the most often become the most connected and most compassionate, and why how we receive someone's vulnerability matters just as much as the courage it takes to share it. Stay tuned for a conversation with Dr. René Roberts, who was rejected from medical school 3 years running and failed her board exams not once, but twice. She hid her story from almost everyone in her life, including her own parents. But today, she is a 3-time top doctor, TEDx speaker, and successful anesthesiologist. Stay tuned. It's a fabulous episode. Thanks for joining us today at the Healing Medicine Podcast. Who are you listening to? I am Dr. Jessie Mahoney, and my co-host is Dr. Ni-Cheng Liang. We are 2 board-certified physicians who bring decades of experience to the conversation about wellness. If you crave more ease and aspire to rediscover your love for medicine and life, one mindful step at a time, you are in the right place. We hope you'll love today's episode, and if so, please share it. A reminder that nothing in our podcast is medical advice. Welcome to today's episode. We have a very special guest today, Dr. René Roberts. She's a board-certified family medicine physician, 3-time Castle Connolly Top Doctor, and a TEDx and keynote speaker who, as she says, got into medicine the hard way with 50 rejections and had 2 failed board exams. And I have invited her to the podcast today to have an amazing and interesting and what I know is going to be a transformative conversation about failure and rejection in medicine and how we handle it and how it might influence burnout and all of those things. I always like to start out just sharing how we got connected because, one, I think it's amazing for us to connect in all these different spaces and to know sort of how this came to the Healing Medicine podcast. And we met at a Women in Medicine panel a couple months ago on burnout. And when I heard Dr. Roberts talking about her story and her experience and her comments about vulnerability and turning rejections and failures into learning, I said, I need to invite her to be on the podcast. And so here we are today recording this episode. I know it's going to be incredibly valuable for so many of you. So welcome to the podcast. And would you just introduce yourself in a less formal way than I just did and share just a little bit about your story and a little bit about your TED Talk, which I have listened to, and I encourage all of you to take a listen to. We'll put a link in the show notes. So,
wow, that is an amazing introduction. Thank you so much, Dr. Mahoney. I'm really honored to be here. I admire the work that you do. Yes, I'm Dr. René Roberts, and I had a very interesting path to medicine. I knew as a little girl who was extremely fascinated with the human body and all its intricacies that I wanted to be a doctor. The problem is that I had no clue what that was going to take to actually get there. I don't have any doctors in my family, which is absolutely fine. And I started the application process just like any other eager pre-med student and probably naive, thinking I was going to get in and get accepted on the first try. And it turns out that it actually took me 3 years to get accepted to medical school. As you well know, many of your audience members know, the application cycle happens once per year. So you better be having a good day. I applied to 20 schools the first year I applied and did not get a single offer for a secondary application, which means no in-person interviews. I decided to lick my wounds, so to speak, and I was going to reapply the second year. And of course, I thought there's safety in numbers. So instead of applying to 20 schools, I'm going to apply to 10 more schools the
In
following
medicine, more
year.
is better, right? We need to
More
apply to
is
more.
better. Exactly. So I was like, well, if 20 schools said no, then maybe next year we'll go for 30 schools. And was told no again by every single school. But something different happened that second year. I applied. I actually got a phone call that changed the course of my life forever. Did not know it at the time, but ended up getting a phone call from Indiana University School of Medicine, which is where I ultimately ended up going to medical school, and was given the opportunity to come to a master's program. So not quite the detour I had planned for. And I wasn't sure I wanted to do it. But my mother said, go upstairs and pack your bags. We're going to have you there. We'll have you there in Indianapolis. I had about 5 or 6 weeks to get there, and literally uprooted my life and went and did a master's program. The master's program did not guarantee me admission to medical school. I had to come and prove myself. It essentially simulated your first 2 years of medical school. And then what they would do is allow you to interview again. And so I did it. I did well in the program, got accepted to Indiana University School of Medicine, and I thought that was it. I thought I had paid my dues. I had done all my heavy lifting. Was told no 50 times, which obviously we'll get into in this conversation, only to find out that my story was just beginning, and the heavy lifting, the battle was just beginning. Come second year of medical school, in between that transition where we're trying to get into our clinical rotations as third years, we all know we have to take the first round of our medical licensing exam, step 1, and I failed. Yeah, by a lot of points, and was extremely embarrassed watching all of my other classmates celebrate their fantastic scores. And here I was getting called into the dean's office saying, hey, you need to take a month off from school. You're not allowed to go on to your clinical rotations. And ended up sitting for step 1 a second time. And I failed again, this time by 3 points. And that was by far the biggest slap in the face I had ever received. It was also one of the darkest moments of my life. So much so to the point that I, was not proud to admit this at the time, but I speak about it now. But in that moment, I literally just asked God to take my life. Yeah, I was devastated, and just could not think of any way to explain myself out of this situation. You've got family members cheering for you. You're our first doctor. And, why are you still studying? What's taking so long? And classmates that are like,
that's such a hand to heart.
And then how do I go back and tell them, oh, by the way, well, not only am I not going to be a doctor just yet at the moment, but I got pulled, from my rotation, and have to take another round of time off from classes, which then put me so far behind that I was not going to graduate with my class. One blow after another, but something miraculous happened in that moment, and God showed up and he answered me right then and there, and literally said this to me. He said, I have a community that's waiting for you. I literally have patients that are waiting for you. They don't even know who you are. They don't know that they need you yet. But who can I trust? Who can I send? Who's going to empathize with their pain, with their setbacks, that cancer diagnosis that we thought was in remission that came back, those patients that are struggling to put food on the table versus pay for their, prescription medications. Who can I trust? And as plain as day, I promise you, I'm not making this up. He said, I'm sending you. And right then and there, it's like everything clicked. The light bulb went off. I couldn't quite see how everything was going to work itself out in the end, but I knew that this mess that I was in had a purpose. And it was going to be used to my benefit and to my patient's benefit as well. The bigger issue is that nobody knew about that moment.
Mhm.
I never spoke about that to anyone, not even my own parents, not even my friends, family members. I certainly couldn't do that because they were just waiting to know when graduation was. And I held that shame and I held the embarrassment for several years, really up until about 2022, when I finally opened up and started telling people the real story. And of course, it was met with a lot of shock
Yeah, yeah.
and a lot of surprise.
And what gave you the courage to share the story?
Well, I look back on it now and it's funny in a way. I was asked to be the keynote speaker for a nonprofit organization that I volunteer with here in Chicago called the I Am Able Foundation. And it's a wonderful organization. I've been with them now as a volunteer physician mentor for 10 years plus. And I was like, okay, well, we were welcoming in our new class of students, high school through college students who are aspiring to be doctors. And I was like, okay, I can do this. Let's talk about how wonderful doctoring is. I'm going to have my little speech all prepared, and got up in front of a crowd and literally froze. Not because I wasn't prepared or not because I didn't know what I was going to say, but it was another one of those encounters where God's like, hey, you better tell them the truth. And I'm
Yeah,
like, no, I can't do that. I'm in the middle of my
yeah,
speech right
yeah,
now.
yeah.
Let me just go ahead and get through this and just tell everyone how wonderful medicine is. And he's like, no, tell them what really happened to you. And I paused. It was almost like the deer in headlights look, right? Everybody got real quiet. Like, is this part of the speech? And I started sobbing. Literally no waterproof mascara. Okay. So clearly it
Yeah,
was not planned. All right.
yeah,
And literally
yeah,
told them that moment about
yeah,
sitting at that desk in Indianapolis, looking at my board scores and just crying out to God. And
yeah.
you wouldn't realize that that's what I've been through. I always say, I thank God I don't look like what I've been through, because what people see is they say, oh, wow, Dr. Roberts, you're like,
Yes.
you mentor students, you've been practicing for 15 plus years, you're in the media, you talk to ABC, CBS, WGN, the Chicago
Yeah.
Tribune, you're a Castle Connolly Top Doctor, you just did a TEDx talk, but nobody knows the real story about how I got to medicine. And it's a conversation that I realized was resonating with the students that I mentor, particularly those that were in that pre-med phase, literally like college students or post-baccalaureate students who had applied and were told no. Or maybe they didn't have such a great time or didn't have a great day, the day they took the MCAT, and therefore were told no. But they have all these other wonderful things that they offer and can bring to the table as a physician, and they couldn't see it. All they saw was the rejection and the failure. And I
What's
said, that
so,
has to change.
yeah, yeah. Well, what's so interesting is I'm hearing echo in my head what you said, that you heard about there's a community waiting for you. And right when
Yes.
you became a doctor, there was a community of patients waiting for you. But I
Hmm.
actually think there's also a community of people wanting to go into medicine who aren't there yet waiting for you. And one of the reasons that I wanted to have you on the podcast, though I didn't make this connection until literally just this moment, is that I also think there's a community out there of people who've also experienced failure and rejection and been told no and made it mean things about themselves and their value, or given up, or spent a career hiding it in shame. And
Yeah.
that community is also waiting for you, because there's just a
Mhm.
huge cost to each individual, but I also think to the whole culture of medicine, like that we can't talk about these things and we can't be vulnerable.
I agree. I agree. And it's unfortunate
Yeah.
that this is, the profession that we love and put so much of our heart and soul into. We meet patients at their worst moment, right? A lot of us, every time you walk into the exam room, it's not, or the operating room, clearly it's
Yeah.
not going to be
Yeah.
someone's greatest day. But we need to be reminded that we're human beings too. as physicians. All of us are not going to come in that white coat or wear
Yeah.
that stethoscope unblemished. I think what I had to learn is that the blemishes, hands down, make you a better clinician.
Yeah.
They make you a better doctor. I'll never forget the words that my residency director had told me when I had applied. I didn't realize this. Again, it was almost triggering again. It was 1,600 applications for 6 incoming intern spots at my family medicine residency program. And I just remember my heart sank because I thought there's no way they're going to take me, right? The girl that barely made it into medical school,
Yeah.
got there,
Yeah.
failed her exams twice, and here I'm trying to go compete for one of 6 slots. And you got 1,600 applications. And I made
Yeah.
it into my #1 residency program. And the
Yeah.
residency director told me, he's like, you know what? I understand that you obviously had some struggles, but he said, if I had to hand you that call pager, he's like, I feel comfortable knowing that you have had your back up against the wall and
Yeah.
you've dealt some blows, because he's like, that's what you need when you're in that hospital
100%.
caring for patients. And it hit me. And he's like, the folks that really struggle, he's been a residency director for decades. And he's like, the folks that we see that really struggle, and again, it's no offense to anyone who is, a brilliant
Yeah.
test
Yeah.
taker, because I know there's a lot of us
Absolutely.
like that
Absolutely.
in
Yeah.
medicine.
Yeah.
I wish I was that person, but kudos to you, to all of you who are like that. But he said one of the toughest things that he sees are the brilliant minds that come in who have never failed,
Yeah.
aced every exam, and then they get to residency and they're handed their first failure. The
Yeah.
first patient that codes on you and doesn't make it no matter all your efforts. It's very hard for them to deal with.
I
Uh,
often talk about in coaching the idea that, like, whatever you've handled, we are so resourced and equipped in medicine to solve problems. And the more challenging it's been for us, the better at it we are. Not that we want it to be challenging, but just to remember that, this gave you skills. I think you called it equipment, right? To help
yes.
you navigate things. And you had this wonderful phrase in your TED Talk, which I'm going to promote again. It's
Thank you.
called Who Gets to Heal? I should have it on top of my head, but
Yes, that's correct. Who gets to
who
heal?
gets to heal? But in it, you talk about this idea that rejection and failure are helpful equipment rather than evidence against you. And I think we don't think about it that way. Most of us take it as a judgment against us or evidence of our inadequacy. So many women in medicine feel so inadequate. And yet, what if those experiences are really, as you say, equipment? Do you want to expound on that a little bit?
Of course. Yeah. Thank you for bringing that up. But you absolutely are correct. You hit the nail on the head. Failure is data. It
Yeah.
is not a personality trait. It is not the
Right.
scarlet letter that you have to wear, feel like you have to wear, because Lord knows I went through that for
Yeah.
years. Holding my head down, walking through the halls, like just not wanting to show up in these spaces as a physician. Um, I didn't realize this, Dr. Mahoney, until I actually started practicing medicine and the patient encounters that I would have. There's so many, different stories. I bring up one in the TEDx talk about a lady, who was carrying a lot of weight, literally walked into the room and she borderline cussed me out. I was like, whoa, I just got here. Like, I'm just trying to meet you for the first time. And she was angry and sobbing. And I said, you know what, there's a story there. There's always a story. Like, let me just sit with her. It was the last patient of the day on a Friday. So now I'm not going anywhere, right? Everyone's leaving, trying to go start their weekend. And this woman is literally sobbing. She had end-stage kidney disease and needed dialysis and was refusing. And I said, man, why are you refusing? Like, this is crazy. Like, this is your life at stake.
Yeah.
And she went on to tell me that, her son had kidney failure as well. And she came home one day and found him dead.
Mm.
So for her, yeah, starting dialysis was just a trigger. It was a reminder of what had happened to her son. And as I sat there and I held her hand, and spoke with her, all I could think of is like, okay, I don't have end stage kidney disease, but I certainly know what it feels like to be given bad news,
Yes.
and have to have, an uncomfortable and unpleasant situation thrown in your lap, and you have to sit with it.
Yeah.
That's when the wheels started spinning, that I said, man, okay, no, I didn't pass my boards, the first time or the second time. I may not have gotten the glow in the dark score that I wanted, but I said, this is what I can bring this into the exam room. I haven't, had my lights flicker on and off and have to make a decision about buying insulin or putting food on the table, but I know what it's like to have to make tough decisions and have your back up against the wall. And I'll let patients know that, no, I haven't had cancer. I'm thankful for that. But I know what it's like to be told no. I know
Yes,
what
you
it's
do.
like to have hope
Yeah.
and, aspire to, have certain outcomes and then be given the exact opposite
Yeah.
of what you hope for. And that's where the connection started with my patients. And the relationship building started, and oh my God, like, you're the first doctor that gets it, like, that actually sat with me and you understand what I'm going through, even though I haven't actually had, that particular diagnosis. It's one aspect with the patients. It's like you'd mentioned too, it's not just pure in medicine, but honestly, anybody that's been dealt a blow or a setback. One thing that is guaranteed in this life is that we will all fail, and that's okay. Like, I actually get to the point where I start rejoicing. Oh, never thought I'd say that, because I know, I'm like, okay, this is it. Something great's going to come of this, because I have a lesson that I need to learn. And I think that's where a lot of us make mistakes, especially as women in medicine, is we're fighting for acceptance, for approval, when we probably don't need to be, seeking those things. And so we hold our heads down. Or we wear the little veil or the cloak of shame, because, I should be smarter. I should know the answer to that question. I should have been able to handle that patient situation better. And it's like, no, let's stop for just a second. Okay, that thing, whatever that is we all have it. Okay, that little skeleton that's sitting in the closet that you don't want to talk about, that you're embarrassed or ashamed to admit. I challenge people to say that's the very thing that you need to lead with.
Yeah.
It's
And
your greatest strength. Excuse me.
Imagine medicine where we led with vulnerability and we led with, what we've learned. I mean, if you think about connection with patients, as you mentioned, but also just connection with each other. So many people feel so isolated and alone. But if we could connect over these things, and I'm just thinking about the field of medicine, right? In so many other fields, failure is not judged in the same way. In the startup world, failure is learning, it's innovation. It's like, oh, well, that's not the right way. We'll just go this way. But in medicine, we kind of close it all down because we don't want to talk about it. And what would the whole field look like if that was okay? And maybe even, I mean, my mind is also going to things like malpractice. Like if we were just a much more open culture, right? Like there's always learning going on in medicine. And if our patients knew we were learning and we were humans and we treated each other as humans, like we probably would have a lot less burnout and honestly better care, right? I mean, even going back to who we admit to medicine, but then even once we get there, like these things that we think are marks against us, or so many women feel inadequate to be there. And what if that inadequacy is, as you said, exactly why we are really good at what we do? Patients don't want a perfect doctor. They want a human doctor who understands what it's like, right? Patients feel inadequate. And we can match up in this sort of common humanity.
Yeah, I think you brought up several excellent points. Like you said, I have yet to have a patient that has ever asked me in the 15 plus years that I've been practicing, I'm sorry, stop, because what did you get on your MCAT?
Yeah.
And what did you get on your step
Yeah.
one,
Yeah.
step two,
Yeah.
step three? First of all, they don't even know what those are. They just, do you have a license? I assume you're licensed because you're working here.
Yeah.
Patience is, remember how you make them feel. They
Yeah.
don't care about your class rank or your, honor society, this, that, and the other, because I see it. I see the patients that come back and have seen you know, the specialist with all the accolades, and they're like, that was the worst experience I ever had. I don't ever want to go back and see that doctor
Yeah.
again because they couldn't relate to me. They didn't even look me in the eye. They were in the room for 5 minutes. They threw a bunch of big words at me and walked out. And I still don't know, like,
Mm.
what the next step is
Yeah.
to take care of, whatever condition. They're like, I want you to explain it to me, Dr. Roberts. That's why I came back here. I'm like, that's why I sent you to the specialist, because
Right.
they've got the, more detailed answers. But it's like, wow, it really is kind of reassuring that it's like, okay, I'm pretty sure a lot of them probably did far better than I did, right? On,
Right.
their boards or this, that, and the other. But what does that say about your character at the end of the day? And the patients
Yeah.
don't want to be in the room with you.
Yeah.
Mm, you
Well,
know?
and I mean, to me, the question comes up here is what's needed to practice medicine today? Because medicine today is also different than it was 20 years ago.
Yes.
And what are we looking for, not only in future doctors, but like in each other? And because we work together as a team in physicians, right? You're sending people to the specialists, and we're interacting even within the group of family practice doctors. Like, it's rare to act on your own in medicine entirely.
True.
What are we looking for? What makes a good doctor? And, from my standpoint, also what makes a sustainable physician, like holding yourself to
Mm.
perfection and never making a mistake, that's not sustainable.
That doesn't work in this day and age. And
Yeah.
I, make the argument that I think the qualities that matter most, and when I
Yeah.
say matter most, I'm talking about the patient at the end of
Yes.
the day,
Right.
don't involve test scores or a transcript.
Yeah.
I think what matters most is empathy,
Yep.
resilience, lived experience. These
Mhm.
are the things
Mhm.
that patients can touch, and they're relatable,
Yeah.
uh, as opposed to hardcore metrics. But it's not only just with the patients. You brought up an excellent point too. When I've opened up and shared my story,
Yeah.
excuse me, about failing my boards, the people whose eyes get the biggest are my fellow physicians.
Yep.
Because then I get the whispers and like, oh my
Mhm.
gosh, you know what? Like, I actually failed my boards or oral boards or this, that, and the other. And they're like, I never spoke about it. I couldn't, they weren't comfortable enough to admit that. And I'm like, I understand. But I think these are the very conversations that we need to have more of. Let's give ourselves permission to
Yeah.
make mistakes and to be human. But
Mhm.
here's the caveat. And we all know there's always the looming litigation, malpractice. We're taught very early on in medicine, if we make mistakes and we have a bad day,
Right.
patients
Right.
die, right?
Right.
So you better have a good day and you better not make any mistakes. But I think
Mhm.
that creates a very volatile situation
Mhm.
for all physicians. And then you throw in someone like myself, who's coming from, a background where I was already dealing with, failures, shortcomings, feeling inadequate. It messes with you. It can, if you're not careful. And I think it can accelerate and magnify, like you said, feelings of inadequacy and accelerate burnout.
Yeah. Yeah. So this is a harder question, but what do we do now, right? Like, how you have been brave enough to share your story. And I think that some other people are brave enough to do that. But we also are in a culture in medicine where it may or may not be safe in certain settings. And how can
Mhm.
we change the culture so it is safe I mean, for me, I do it in small group retreats where people, it's small and safe. And there's this, or even in one-on-one coaching, I'm often the first person anyone's ever told about a failure or a rejection. And yet what I would say is almost everybody has one somewhere along the way. Like you can't get this far without having something that didn't work
Exactly.
out. But how do we change that culture? How do we support one another? And how do we change it also, I think, for the next generation, right? Because we were talking about how most people who listen to this podcast are not med students or applying to medical school, but they are evaluating those people, and they're evaluating trainees, and they're evaluating people along the way. And how do we change the culture about what we're looking for, and how we change each other, and how we handle this, shame, failure, rejection, all those things?
Yeah, that's the $1,000,000 question. It's the $1,000,000 question, but I think it starts at the micro level.
Yeah.
One small conversation at a time. For those of us that are, already practicing, attending, like you said, most of the people that are listening to this podcast are not, in the application phase or pre-medical students, but those of us that sit in those positions, whether it's on an admissions committee, a mentoring group, or you've got the students rotating through your office, through your clinic, I think we owe it to ourselves and we owe it to them to show up truthfully. Don't sugarcoat. It's one of the first things I tell the students I mentor. I said, okay, I don't mind working with you, but I'm going to give you the real deal version. I will not sugarcoat. I want you to know what really goes on behind closed doors so that you can make an informed decision, right? And you can get an unbiased view of what it actually takes to practice medicine. And I kid you not, I have yet to have one student that said, Dr. Roberts, I wish you would have never done that. It's the exact opposite. They're like, man, I'm so happy that you're showing me both sides of the coin, right? That you can survive and thrive, right? Not just get by. But I am a firm believer that it still makes you a better doctor, but we have to start having the conversations. I think even before we can have the conversations with others, we have to be willing to have the conversation with ourselves to say, you know what, enough is enough. Like, and I got to the point and I said, you know what, that's it. I'm done hiding. I can't do this anymore. It's like you're going to cover up a lie with another lie with another lie, and then you can't even remember the first 3 set of lies you said to try to cover up the other back half to try to make yourself look good. It just gets to be too much, and it's exhausting. We have enough to deal with, right? In medicine, oh my God. Okay, like you said, the compressed appointment times and insurances and prior authorizations and, decreased reimbursements. I mean, the list goes on and on and on. It's the last thing we need to do for our own, mental, spiritual health is to walk into that exam room trying to cover up, our own issues.
And as I'm thinking about it, like if you're thinking about things that contribute to burnout, that needing to be perfect and having that sort of gold-plated patina on the outside, I call what I do helping people who are successful on the surface but struggling underneath. Like that's the shame underneath. And it's like we all have that, but that's very expensive emotionally and energetically to like hide it and contain it. And the job is too hard. And so imagine if we could all be more honest. I often say vulnerable, but elegant vulnerability, i.e., we don't just sort of vomit up all of our all of our problems, but sort of explain it in a way of, yes, this happened and I survived and this is what I learned from it. And if we were all more open, I think there wouldn't be so much shame around it, right? But it's going to take one person at a time. And then those of us hearing that person share, being respectful and not judging, right? Because we judge each other. Oh, I can't believe they, whatever, right? And so it takes all of us showing up with kindness and compassion to create a different culture.
Yeah, I agree. I think that's an excellent point. And I want to challenge your listeners who are in that space right now, whether they want to admit it or not, or know that they need to, but this very well may be your opportunity to be that person.
Yeah.
The person in your office, at your hospital, at your solo practice, group practice, whatever that may be, that sets the standard and changes the course for the other, your fellow coworkers or those that come after you. It starts with us. It starts with one person standing up and saying, enough is enough. I'm going to tell people the truth and stand for what I believe in. I'm going to show up as my authentic self. And this is what authenticity looks like. It's blemished. It's messy. It's got dings and scratches and bruises, and it's okay.
And it
It is
might be a
okay.
failed test. It could be a mental health thing. It could be a promotion that you wanted or a leadership role that you wanted. I mean, to me, these things, it's really the shame, like anything that you have felt shame about. The only way for us to lessen shame in medicine is to start talking
Is to
and to
start talking about
normalize it and support each other.
Yes. And I think that brings up another great point too. And man, this is whoever can crack this code
Yeah. Yeah.
will make it is our areas of employment, whether you're self-employed or you're working for, a hospital group, clinics, what have you, is we need psychological safety.
Yeah.
And I think that's where the ball drops in so many areas. I would love to speak up, but like you mentioned, I'm going up for the promotion. I'm going to be the next medical director, the CMO, the what have you. And if I let people know that I went through this or that I struggle in this area, they're going to perceive me as being weak or incapable of doing the job.
I do think one of the types of coaching that I do is leadership coaching. And I think if leaders are specifically vulnerable and model vulnerability, right? If they can model it, it gives the rest of us permission to do that, or anyone that they're leading as well. Just like if they model wellness, then it's okay to practice wellness or taking care of yourself. But if they model self-sacrifice, then nobody else can do that. So same thing, if you're a leader modeling vulnerability, or as an attending model vulnerability for the residents and fellows that you're teaching, or whatever it might be, that each of us can take on that agency. The other thought that came to mind as you were talking around this psychological safety is start in safe spaces, right? So small group coaching, or in a retreat, or in a women's group, or with one person in your office who you feel safe with. And then I think the other task is, again, on the receiving end, that the other people be kind, compassionate, respectful, and non-judgmental. Because I talk about this a lot. We're trained to be judgmental in medicine. So we hear that. And even when we want to be so kind, our brain is also like, oh, thank God that didn't happen to me, right? Like we get into this compare and despair in all the which ways. And for all of our healing and to create a more sustainable culture in medicine, I think the person who's being vulnerable and the person on the receiving end of the vulnerability, like we all have a role to play in this. And if as receivers, we keep these things safe, it allows the receiver to then also be vulnerable, right? Because it was a safe space. And so how can we create these safe spaces, find them, nurture them? And I think, to me, we kind of have to start there. Like, I wouldn't go assuming that your whole organization is ready for this, but
probably not.
Little by little, right. Little by little by little, opening up about these things could be so powerful.
That's true. And for the receiver, we are in medicine, right? As physicians, we are so conditioned to find the problem, find it quickly, and offer a solution.
Yes.
And I think with matters like this, it's okay to not have a solution. This isn't something that has to be fixed at all. Let alone
such a good point.
Quickly. So half of the battle is just give me a safe space to let me share my experience in what happened to me. I don't need a quick fix. I just need a head nod, or I feel your pain. I empathize with you. I'm sorry that happened to you, but wow, look at what you're doing now. And this is great that you're, helping others with what you do, as opposed to, like you said, the
Have others been able to do that for you?
I'm sorry, could you repeat that?
Have others been able to do that for you? Well,
oh my gosh. Wow. I know. I have to stop and think about that. I'm not 100% sure. I think when I have opened up, and again, just started opening up with a lot of this even
Right.
at work. A lot of it was just with students, but then as I started to do
Your TED
this,
Talk.
yeah,
You put it
well,
out there in the world, right?
that was a big one as well. And I thought, wow, okay, this is it. Like you get out here and step on the red circle at TEDx, everybody's going to know your business.
Right, right,
Previously it was in safer spaces.
right.
These are people that I know. So it's like, okay, maybe the judgment meter might be less.
Mhm.
But TEDx was definitely, I'm about to share this with the entire world. Here it
Yeah,
is. But,
yeah,
people came up to me and said, man, complete strangers.
yeah,
I'm so glad you had the courage to say that,
yeah.
because this is the same exact thing I was thinking, or this is the same experience I had, with my own loved one who, didn't have the best care,
Mhm.
couldn't communicate with their doctor. So
So what I'm hearing from you is sort of you started in safe spaces with safe people, maybe building confidence, and then,
branched
and
out.
I'm very clear now that we've had these two conversations that you, at this point, are confident enough that you know there's value in it. That if not everyone likes it, fine. But I'm guessing you didn't start there, but that you've sort of built the courage and the confidence over time to share it wider and wider.
Yeah. And I think even when I started, mentioning that with students, I'm not going to lie to you. I was waiting for the bomb to
Yeah,
drop to be
yeah,
like, ew, well, don't talk to Dr. Roberts because she doesn't know what she went through too much. And
yep,
I don't want to I don't want that on
yeah,
me. Like, get away
yeah,
from me. And
yeah.
I said, well, you know what? That's fine. Because I may not appeal to everybody, but if it's just one person
Yeah.
that I can change, change their outlook or change their course, then my job here is done. And
Yeah.
it turns out that they started telling their friends about me and said, hey, go talk to Dr. Roberts. That very thing you're going through right now, she
Yeah.
went through that, believe it or not. And it really, I noticed that the conversation was needed. And that's what they actually started asking for. Because they're like, hey, look, I can go to any other doctor. I hear all of the, all of the good, warm, fuzzy feels about being a doctor, but this is what really resonated the most, because a lot of people are going through that right now. The stats are crazy. We know how hard it is to get into medical school or get
Yeah.
into that residency
Well, and
program.
I
So
think that's what caught my attention is I'm like, wow, so few people talk about this, and what an important conversation around
mm-hmm.
vulnerability and what courage. And that was what got me to say, hey, will you come on the podcast and talk about this? This is something we need to
Yeah.
talk about. And since I have listened to your TED Talk, and I think the message resonates well beyond like who gets
Mm.
into medical school, like how do we handle this as a culture in medicine, and how do we take care of those to whom this has happened? Because as you say, it's so hard to get in now. It's probably a higher and higher percentage of people who've done this more than once
Yeah.
and twice and three times. And then this new idea to me is like, well, what are we looking for in
Yeah.
medicine for physicians, and what is, I don't mean to say required, but what is most helpful for what type of person is going to be able to get through medicine these days. And I think what I work on, I call the school of unlearning, like unlearning all those things
Mm-hmm.
that
Mm-hmm.
generally made us great test takers and made us great, non-failers and
Yeah.
perfectionists, but they're not
I like
sustainable
that.
in medicine today. So we
Yeah.
actually have to go back and unlearn it, so
Yeah.
that we can practice in ways where we are vulnerable and connect and are open and honest and transparent.
Because there's so much focus on that, because I
Yeah.
see it.
Yeah.
That's it. It's just like the blinders are on and that's it.
Mhm, mhm.
I have to nail the MCAT or my
Yeah. Yeah.
life is over. I'm like, you're
Yeah.
20 something. How is
Yeah.
your life over?
Yeah.
You're just getting started, but that's literally the lens
Yeah.
through which, a lot of our future doctors see the
Yeah.
world is, if I don't nail this test, my life is over. I'm like, okay, really? Like, let's
Yeah.
unpack that for
Yeah.
just a second, because again, and I even ask you too, Dr. Mahoney, how many of your
Yeah.
patients have ever asked you about
Yeah.
your class rank, your test score, your
Zero.
GPA. Okay, see, there you go. I mean, it may not be a scientifically
Well,
proven
and
study,
outside of
but
medicine, I don't think patients have any idea the tests we take and what we do. They don't get it at all.
and I honestly don't even think they care,
No.
because if I'm sitting at home and I find a lump in my breast and I need to go see my doctor and I'm sitting on that exam room terrified with that gown on and my backside out, I don't really care where
Yeah.
you ranked in class. I don't care if you're AOA, I don't care, honestly, if you scored in the 99th percentile on step 1, 2, or 3. I need to know, do you get me right now? Do you understand the fear that I have? Can you relate to me? Can I even talk to you? Can I have a conversation with you? Like, that's a
And
big
can you
one.
get me the help I need? Because it's,
Can you
especially in primary care, we're not usually the help they need. We're the
exactly?
connectors. I'm a
We're the
primary care, right? We're the
connectors.
connectors and the ones who
Mhm.
need to know if it's dangerous and what needs to happen next.
Exactly. And these are the conversations. The downstream
Yes.
effects is what I
Yeah.
bring to the forefront, particularly, when working with students, because I'm like,
Yeah.
there's life beyond your test score. There has to be.
Yeah.
What do you do once you get in? Now what?
Yeah.
Oh, I did well, but then you can't even have a
Yeah.
conversation with the patients or their families. That's equally important, because again, ultimately, like I mentioned in my TEDx talk, it is going to determine how well you, myself, your loved ones, your siblings, parents are going to receive healing.
Yeah. Let's end with this. And I'm not going to quote it just right because I wrote it down when I was listening to your talk. But you said in it that when we're losing healers, um, we are the patients who need them most are also losing out, and all of these people who are losing out, and whether it be by test scores or overgiving or burnout or shame, and my brain also goes to the high rates of suicide, which usually doctors, which come from shame and
Yes.
come from failures and lawsuits and things like that. Like, we're losing healers themselves. And we're also ultimately downstream losing the patients, right? Because they don't have those healers who can connect with them. Do you want to just
Exactly.
reflect on that? Because and I said it so not eloquently, so hopefully you can remember what you said, but it was
No.
really powerful for
Yeah,
me.
no, I think
Yeah.
you did a great
Yeah.
job, but yeah, it really was, a lot of the premise and the idea behind the TEDx talk. It really got me thinking. This goes beyond, again, who we're letting into medical school, but it made me stop and think about all of the people who are becoming doctors, who on paper, like
Yeah.
myself, wouldn't be here. And I think about the impact that I've had, just me, just one family medicine doctor, you know, in Chicago here, have had on this community. What if I wasn't here?
Yeah.
What if the doctor that catches your cancer or helps your child, what if they weren't here? And we really stop and take a step back and think about that. It's a public health crisis.
Yeah.
This impacts all of us.
Yeah.
And I think we each have a responsibility.
And
In a role.
burnout and shame similarly, right? Because people are leaving medicine in droves, particularly women.
Yes,
And I think a
that's a
lot of
big
it
one.
has to do with unreasonable expectations and feelings of inadequacy and it not being a doable job. And
Exactly.
my guess is also a lot of stories, just because people I work with, there's so many stories there, right? We all have our stories of something we didn't get. And it's like, well, I've given so much to this and,
Yeah.
I feel rejected, so I'm out. But
Mhm.
how can we change our way of connecting and being vulnerable and being honest and open so that we don't lose healers and we don't lose patients as a result of it?
I think
Yeah.
we definitely need to place value, a higher value, on creating or having those conversations, creating those spaces, because you're absolutely right. Like you said, this isn't, like you said, just a pipeline into
Yeah.
medicine problem. But for those of us that are in medicine, how do we stay in
Yeah.
medicine without, like you said, burning out? Because it does wear on you. It does. And
And
places
holding
are,
this wears on you. Like it's all of it. It's very much an interwoven web or blanket,
yeah.
a
And it
heavy
makes
blanket.
it pains me to think about how many of us have left for
Yeah.
that very reason.
Yeah. Yeah. Or
They could
given
still
up
be
along the
practicing.
way. Yeah.
Hmm.
This was such a powerful conversation. I have taken great delight in it. Is there anything else that we didn't touch on that you want to share at the end before we close this out?
Oh, well, first of all, thank you so much for the invitation. Absolutely loved the conversation today. I think if I had, oh my goodness, uh,
Yeah.
lasting message is to give yourself grace. We all need to give ourselves grace. And my tagline, which I repeat over and over and over again, it's not what stops you.
Yeah.
Life is not about what stops you. It's about that next decision, what you choose to do next. What is going to be your next move?
Ooh, that's so good. And I think that so many people have found themselves stopped and stuck. And so
Mhm.
just letting go of what's stopping and stucking you, I realize that's not a word,
Yes.
but and what just moving on to what's next. Like we can put down the heavy weights or the ankle weights or the burdens or the heavy
Mhm.
backpack and move on to what we love with grace and compassion that's
Yes.
in common humanity.
Yeah. It's a stepping stone. It's
Yeah.
absolutely a stepping stone. And I think if we enter into situations, conversations, places of employment, and beyond, knowing that what has burdened us is not to keep us down, but it serves a purpose. It always serves a purpose in the end.
That is a beautiful way to end this. And I want to, one, thank you for coming on the podcast, but two, really thank you for being vulnerable and being willing to put this out there because it's going to help immeasurable numbers of people. And I hope even save some lives. I'm
Yes.
certain it
Yes.
will. And I think that for each and every one of us who's willing to be brave enough to speak up and share and be vulnerable, we can change the culture one physician at a time. And
Yes.
and maybe two at a time, the person who's vulnerable and the person who receives it. If we're all taking good care of each other, we'll get there even a little bit faster. So much
Fantastic.
gratitude to you for joining us. And we will maybe have you back someday, hear more. And
I love it.
can't wait to hear the feedback. And if anyone listening wants to share their vulnerability and send it my way or Dr. Roberts' way, we will receive it with grace and love
Open
and
arms.
care. Yes. And for some of you who feel like that this might be an invitation, maybe this can be the first step.
I love it.
So
Thank you so much.
yes. Thank you all for listening and stay on after the singing bowl for the mindful moment. And we will see you next week.
Thanks for listening. If our message resonates, we'd love to connect further. Join us for coaching, mindfulness experiences, workshops, and retreats. Invite us to speak at your institution or conference. When you work with us, you don't just consume information, you create real change. Find me, Chang Liang, at Awakened Breath, and Jessie Mahoney at Pause and Presence.
Welcome to today's mindful moment. This moment is going to be an opportunity to set down something that you've been carrying. So I invite you to set down anything that you are actually carrying and find a comfortable seat. If you're standing, notice your feet on the ground and close your eyes. And if you're sitting, settle in. Notice your feet on the earth beneath you, closing eyes, dropping into your body. Again, only if it's safe. And reconnect to your breath. Bringing a hand to heart as well as we begin this practice, breathing in through your nose and out through your mouth. Once again, breathe in through your nose and out through your mouth, settling yourself, priming your nervous system for some moments of reflection with the breath, shifting your physiology with the inhale and the exhale. And with your hand on your heart, consider something that you might like to set down, to stop hiding, to share, to connect with someone about. What have you never shared or been tucking into this space of shame that you might like to put out into the open? How might you feel lighter or more liberated if you were no longer carrying whatever that is? Remembering to breathe fully and deeply here as you ponder this idea. Is there something that you would like to put down that you have been carrying as a measure of your inadequacy or lack of worth, or letting it be evidence that there's something wrong with you? What if you put it down? What if you moved beyond it? What if you stopped hiding it and shared it with someone, not anyone, not everyone, but someone with whom you connect, letting the burden of the heavy weights go? And maybe you're not ready yet to share it, but maybe you just want to place it on the earth, leaving it somewhere. Just like I've sometimes offered in the past, leaving your anxiety about something somewhere. Maybe you leave the burden, the shame, the guilt, the feelings of inadequacy, the rejections, putting them down, letting go of the weights, and allowing yourself to move forward as a whole and human person with the learnings from whatever that was, but not the shame. Coming back to the breath. And if this feels like too much of a challenge, just simply consider the idea. Consider what those things might be. Begin to ponder them and think about them without having to take action. There's no rush. The considering is the first step to being ready with kindness and compassion. Remembering that you're human. How might letting go of some of this stuff allow you to be more human? Allow you to connect better? What community is waiting for you if you could share some of these things and put them out there? Sending yourself compassion for the lived experiences that you've had, for the hard feelings that you may have felt, for the person who wasn't comfortable sharing, who felt shame, and just honoring her, witnessing her, sending her kindness and love. And for today, that's it. Just recognizing it, considering, pondering, no action needed, sending yourself more kindness and compassion. And I invite you to stay here longer if that feels like it would be helpful. But if you're ready, you can lower your hands and open your eyes, and we'll come back together. Moving forward in the week with the invitation of exploring this. May you all have a beautiful week. May you all set down a bit of shame, give yourself some grace and compassion, and move forward a little bit lighter, a little bit more liberated, a little bit more free.